And action. Hey everyone, it's Dr. Rick. Brandi had a question on sleep and mindfulness. Sleep mindfulness, mindful sleep. Whatever you want to call it, I think that we are really in an era where we are being hit by interference 24/7 to really screw up sleep. So sometimes being mindful of your problem might be able to give you direction on how to solve it. I really think all of us, every patient I have, has the answer to what they're suffering from. It's just up to me to extract and give a timeline or a path out of that suffering. If this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So mindful sleep. This is a picture of one of the hikes I go to, local to me. It's called St. James Farm Forest Preserve. And pretty nice, this alleyway of trees. You're flanked by huge trees on each side. A lot of people go there to film wedding pictures. It's just the end of the trail, and it's nice when you come out of the woods and you just go down this line of majestic trees. Really makes you feel calm. So there is calming practice or a sense of when you're in nature, when you're surrounded by nature, because you have no choice. You have so much external stimulation by smell, sound, not really taste, but feel, that your senses, your brain is overwhelmed and will eventually kind of fall into the moment. It'll make you think about the moment. It'll make you stop thinking about projecting forward, which is the speed of what the internet does. Internet, social media, multitasking all gets you to think about the next step. You're always projecting on. You're not really in the moment, you're momentless because you might have seen where you're going to be, potentially what's going to happen. You kind of know where you are now. You're ruminating about where you were before. It's very distracting, and the brain can handle that as far as problem solving and surviving. But I think that if you look at the work of Dan Buettner in the Blue Zones, which I reference a lot, he went to figure out which parts of human civilization live the longest, and in hoping to see a resemblance or the common theme with all those different cities and places in the world, maybe we can mimic that. And it's really cool. Population studies. There is validity to population studies. The only problem is sometimes it's hard to extrapolate exact bits of data and apply it to you. We just give you a general sense of direction. So if I'm a life coach and I have to figure out how do I get you to stop the suffering and how can I get you to live without sequela, without injury, without surgical problems to a long and healthy life, it takes analyzing where you are, compare you to the regular population, compare you to the how people lived in the past, and then also anticipate what's going to happen. And we change that. And one of the biggest things, I think that, barring the top 3 killers, which would be cardiovascular disease, heart attack or stroke, neoplasms or cancer, and then neurodegenerative diseases, barring all the details of that, food, exercise, avoiding cancer-causing tobacco or other agents, keeping the brain healthy, stopping inflammation, avoiding all that stuff. I think that overlaying on top of nutrition, exercise, sleep is mindful practice. I always speak of it, and I've had a couple of videos and lecture series on mindful practice. I believe if you click down below, you'll be able to see my links. But it's usually the hardest thing to teach or empower somebody with. I still have the pushback, and I don't continue to hark on the status of you're missing a mindful practice. We really got to do this. But interlaced in all the changes that we make, whether it's nutrition and calming down the craving process, exercise and getting motivated to go and exercise when it's cold out, sleep and trying to turn off the brain when you're thinking 20 miles an hour and you're supposed to be just blissfully dreaming. I think that it's important to, again, it overlays all these things. So I think it's very It's an imperative that you learn or develop your own calming practice, mindful practice. But as far as where to start, everybody's at a different level. We are just so surrounded by 24/7 that I think the paradigm now is totally different than what we went through, or what the folks that are now 100 have gone through in the past. The advent of internet and information highways on the 24/7 demand, and a plethora of information once you open up that window, it's just so much, it's so overwhelming, it'll outpace even being surrounded in nature. I once took a group hiking to a nice elevation, and we were surrounded by majestic views, and there was one adolescent that was still playing. He couldn't stay away from the tortuous device that he brought, and I think it just speaks to how much of a battle there is between surrounding yourself with what would seem like something that calms and engulfing yourself in something that distracts. So, and what's the problem with distraction? Well, the problem with distraction is that it induces, not all the time, but it induces a fight or flight reaction, stress, anticipation of how people will like you or give you a like, another movie that's coming out and seeing the preview, seeing argumentative conversation on the internet. All of that it gives usually you a sense of where you fit in the world. It makes you think who you are, looks back at you, and then how everybody else, and how you compare to everybody else. So it's really the opposite of what we're supposed to be doing in nature. Nature is supposed to be, we're just existing, this is here, we're a tiny pebble, and it's not that important as far as social status, or how your hair looks, or what you're wearing. I often tell my patients, I don't care what I wear. I don't think I have any more ties. And do I care that I go to meetings and I don't look the same as other doctors? No, I don't. I have the privilege of being able to do that. I don't think my other colleagues look down upon that. I think they see how I treat my patients. My patients speak for themselves. So thank you, patients. But in this case, Brandi, where, or you all who are also listening, in the case of when we're surrounded by chronic stress and the reaction to that stress. So here's what I was getting at. When you're having a stressful trigger, whether it's somebody tailgating you going 50 miles an hour, or you're running behind, or your doctor's running behind and making you run behind, or you can't sleep and it's 3 in the morning and you have a project the next day, or your kid is sick and you just want to take a nap, or you're hungry and you can't find anything except for crappy McDonald's foods. All those are stressors. Or even being sick or injured, those are all stressors. Looking yourself in the mirror, stressor if you're overweight and you haven't hit goal. Looking at yourself on a scale, all these are stressors, and they induce a stress reaction. Stress reaction usually means that glucocorticoids like cortisol get secreted. And when cortisol gets secreted, the adrenal cortex, which sits on top of the kidneys, there's a kidney on both sides of your back, and on top of the kidneys, kind of a triangular gland, and the gland secretes cortisol. It's supposed to, there was a movie called Inner Space, where the little astronaut guy that was inside the human that got shrunk down, he was trying to get the human to fight a bully. And how he did it was, the human was very passive, so in this little craft that he was going around with, he went to the human's adrenals and he stimulated the adrenals to get the human to fight faster. It was pretty cool. But so that's an exact example of what happens physiologically when you're under stress, or when you're exposed to some stressful reaction. And that could be, I know a lot of my patients say, well, I'm not stressed, and then I'll dig deeper and I'll find the standard things that are stressful that my patients usually didn't consider stressful. So there's always room, even the best meditators, myself included, there's always room to calm. And it's very difficult to get to that level. It takes practice. It's very difficult to do a pull-up, a squat, run a 5K, but it takes practice. Just like Deepak and Andy Weil. Andy Weil, who was the first one who taught me how to do 4-7-8 breathing. and I have a link down below, and I think it's a non-generic, easy to apply form of mindfulness. Deepak Chopra, one of the two doctors at the Chopra Center who taught me how to meditate and teach yoga, also teaches more deeper traditional forms of meditation. But whether you choose the easy or the difficult, or find your own mentor, so I think a behavioral therapist is very crucial for designing that stuff. I mean, there's other benefits to going to a psychologist or a licensed counselor, and they can give you guidance, especially if you're confused, if there's too much stimulation, if you're deep embedded in bedrock of always defending yourself against stressful reaction, and you have your own stress busting reaction to the stress, which is usually anxiety against more stress. That's not a good thing, especially when it comes to, it's good when you're trying to problem solve and take care of multitasking and get to a destination unharmed, hopefully. But it's not good when you're trying to make love, when you're trying to sleep, when you're trying to nurture your children, when you're trying to digest. It's not good for all those things, and that's where we have all the diseases. So insomnia, IBS, irritable bowel syndrome, impotence, perimenopausal symptoms that are out of control. So all those diseases are, I think, based in a strong foothold of not having a stressful, calming practice. So that's where it brings us back to mindfulness. And if you, at the least, can't do the 4-7-8 thing, or you're not getting the benefit out of it, and this is usually 10 minutes twice a day to start, I tell my anxious patients just try 5 minutes. But at least it's a beginning. And it helps you control your breath. It helps you control removing yourself from all the external stimulus and maybe falling into this little fraction of a second of, ooh, that was kind of cool. And it's not that you have to do a half hour of this stuff, but sometimes even a fraction of a second of being in that moment when you were doing the 4-7-8 breathing, for example, and you just thought to yourself, where am I with the 4-7-8? I forgot. How long am I doing this thing? Usually that fraction of a second when you realize that you're doing something and you're not sure where you are in the process, that was mindful. That's when the serotonin and oxytocin levels went super high, really quick, and usually you can only be in either stress response or a love response. A friend of mine that I met at Harvard, Ava Selhub, has a great book. I'll try to put down below too, for men and women as far as the love response. And there's benefits to that. I think there's cancer-fighting benefits to having high levels of serotonin and oxytocin. And like I tell everybody, if you get into a good mindful practice twice a day, that serotonin and oxytocin will carry you for half the day and until you do it again. And I think it's better than a pill. It's the first step when you have anxiety or depression, and it also it's got no side effects to it. You just have to learn, and the learning curve is a little steep, but if you're patient with yourself and you have that scheduled, I'll do it for 3 months and give it a retry, or get somebody else to teach me, go to a psychologist to maybe design one for me. I think when you're dedicated like that, you will get to experience it, versus going out to Yosemite or Grand Canyon or the Tetons and just engulfing yourself and surrounding yourself with calming nature. So the objective, again, is to have a practice and to know the benefits of that practice. In Brandi's case, doing ultra marathons, I think, was a way to overdrive that anxiety type reaction that she had to common stressors. Brandi, I think that's good, but as I've alluded to in prior lectures or podcasts, when you get to that level of calm in an exercise routine, whether it's an Ironman, a Spartan run, a long swim, something competitive, you have to turn on the muscle response to get to that point. And I think you have to turn on stress response to get to feel cool, which is kind of defeating. If it's the only way you can do it, fine, but it's kind of defeating because you have to turn on stress response to get to this level of endorphin and enkephalin high. And you will get high with that because it stimulates the same parts of the brain as being on narcotics, Schedule 1, Schedule 2 substances like marijuana, cocaine. Now, what better way to feel cool and feel high than doing that without doing anything illegal or without taking a substance in. But again, it does take practice. And I think if you do it enough, number one, your inflammation levels will go down. Here's the benefits to all this stuff. The inflammation levels will go down. If you control inflammation, you control disease. If you control disease, you get to 100 years of age. You will also have great sleep. If you can have great sleep, wake up refreshed. And great sleep doesn't mean you go to sleep at 10 and you wake up at 5. It means you wake up without an alarm clock and you are just ready to go and attack the world. Usually 7 to 8 hours is what I tell people to shoot for. Some people fall in and out or below or above that curve, but I think that's basic that you have to shoot for. Because if you're going to have stress, if you're going to exercise, if you're going to digest properly, you have to have a downtime where the body can rejuvenate, where the gut can rejuvenate. So it's important to have that kind of practice. It also decreases the cortisol secreted during the day. So it helps with muscle rebuilding, it helps with repair, helps with calming practice and getting better sleep. It also helps with digestion. And again, during the times of the day when these little tiny stressors start to accumulate, especially if you're a working parent and you have technically a full-time job and you have to take care of a child, or you have to take care of a parent. So that's also important. Caregiving is also causes burnout. So no matter what, if you have a trigger during the day that wants to trigger you and you're really well versed in calming practice, it won't bother you as much. You'll be able to problem solve around that little trigger, and you'll be able to get through your day without having too many spikes in cortisol. Cortisol is that thing we talk about. You're supposed to have it. It's a hormone, just like DHEA, that's secreted from the adrenal, those two glands back here. It's supposed to be high in the morning to wake you up and start your day, and it's supposed to taper off by 50% by noontime and slowly taper off until evening time. I have a video I'll put down below. And by evening time, melatonin comes up, and then it slowly tapers in the exact opposite. So if you have enough cortisol in the morning and enough turned off at night, enough melatonin at night, enough turned off in the morning, then you're perfect. Diurnal sleep circadian rhythm. But the problem is we usually reverse that, whether it's shift work or high stressors at home or being abused during the day or being totally stressed out with no calming practice, having anxiety, whatever it is. Sometimes we can shoot for rhythmically getting a cortisol high in the morning and decreased in the evening. But again, it takes mindful practice in addition to a couple other things. For those of you who can't turn on melatonin at night, you go high cortisol in the morning and you hopefully decrease. Sometimes DHEA will get you there if you substitute it or take it for a couple of months, weeks to months, and then it decreases. And then melatonin shoots up. Sometimes if you can't do that, well, you do the DHEA in the morning. So this is the science of it too, where you can take supplements. DHEA in the morning, 25 to 50 milligrams, melatonin at night. So sometimes doing that will help support or bookend your circadian rhythm reset. And I have a video on that too, but I'm getting too long with the videos down below. I think that for people who are totally stressed out at night, melatonin and sometimes magnesium or phosphatidylserine also work well, in addition to getting the brain in sync with your gut. So the brain looks at sun, the gut knows the timing of its meals, and they both work together to give you a rhythmic wake-sleep cycle. If you're totally stressed out, then you're not going to have any wake-sleep cycle, and eventually that's inflammation. So it can usually be seen in some studies that the more inflammation you have unanswered by calming practice, the higher your chances to get into inflammatory diseases and express those ultimate problems from those diseases. And again, the diseases are going to be cardiovascular, neoplastic, and in some cases neurodegenerative. So we want to avoid that. In fact, if you do avoid that and practice like you live, again, they didn't have internet back then, so I think it's a different ball game, but it's still the same thing, just a little bit more complicated on how to apply it. If you do all that stuff, you might get to the point where you push those three diseases, heart attack, cancer, and Alzheimer's disease, for example, to 100 instead of experiencing those things at 60, which a lot of patients are headed towards. You might not feel anything in your 40s, but if you go unbalanced and you continue on, in your 50s, you'll start to manifest a couple of different diseases on the labs. in your 50s and 60s, you start to manifest the diseases physically. So we don't want to go into that direction. We want to be different than the average American. Average American usually has a disease or several, about 3 to 4 different pills by the time they turn late 40s. 3 to 5 to 7 different pills by the time they're 50, and then some manifestation of that disease, whether it's heart attack, stroke, or other disease. So it's my job to coach you on how to avoid that stuff, but it's really your job to kind of put all this stuff into your own template and apply it to your life and try to do it for a short time. If it doesn't work, then we reconfigure it and try to reassign our priorities, but keep on changing and trying to evolve. And that's why diets, I think, it doesn't matter which diet you're on, the fact that you're mindful about your eating will get you to the point. Now, losing weight, no question. The basics are, if you lose weight, you usually will decrease your disease. If you improve sleep, you usually decrease your disease. But, it's easier said than done, and sometimes it takes a little bit of guidance on how to, especially if you're in the millennial presentation of disease, it might take a little bit of shifting around of priorities to get to a certain spot of success, see that success, bathe in it, and then get daisy chained to the next successor. I think coaches are very important, psychologists, licensed counselors are very important, doctors that do integrative medicine, chiropractors, acupuncturists, they're all very important. But the first step is usually like what Brandi did by coming on in after not having been seen in a long time, coming in at least getting the second opinion. Now, if you go to a regular doctor, I would be careful. So you probably should review, I don't know where you review stuff, on Google or Vitals or USA Health, or whatever it is. Review what kind of training your doctor did, because that doctor might just give you a pill and another pill, which is okay for a short time. But again, you can't just rely on the pill. You have to make the lifestyle change. So great question, Brandi. Hopefully the rest of you will get a little bit of benefit from this. If you know anybody that needs it, send them the link and share with everybody else. Otherwise, I will see you in the clinic.